Hi, my name is Olivia Burrows, and I did my case study presentation on spinal fracture with Cauda-Equina syndrome. Case study background knowledge. The patient is a 25-year-old male who was a construction worker and had fallen over 20 feet and presented with back pain and sensory loss from the thighs down. What is Cauda-Equina syndrome? According to the Cleveland Clinic, Cauda-Equina syndrome is the compression of a collection of nerve roots called the cauda equina. These nerves allow you to move and feel sensations in your legs and urinary bladder. In the image demonstrated below, you can tell that it is a lumbar spine and there is some inflammation in the spine. You have the intervertebral disc with annulus fibrosus and nucleus pulposus. You have the spinal nerve root, and then the central prolapse of the lumbar disc, and then the nerve roots compressed within the crushed spinal canal. The location of the pathology is the nerve roots are located at the bottom of the spinal cord that affect your legs and bladder. So in this image, this is actually a CT image of my case study with the male, and you can see the arrow pointing to in the middle is the compressed spinal canal, which is what is causing the cauda equina. Changes to the tissues adjacent to the injury. The surrounding tissues would become inflamed due to the white blood cells and fluid going into the injured area. Edema occurred, which was caused by disturbed local venous circulation induced by chronic spinal cord compression. And this patient presented with numbness from the thigh down, which is from the narrowing of the spinal canal, like I said earlier. So for the consistency, shape, and border, there wasn't a lot about this just because it's in the spinal canal and it's like the decompression of it with the nerves, but it would be a heterogeneous pathology because it's not genetic or something that happens when people have a traumatic fall, get tumors in the spine and stuff like that. It would be a circular shape, just like image B with the arrow pointing to it, and then with the impingement on the spinal canal. And to these images, it makes me think it's a smooth border around the pathology. For the distinguishing characteristics, it can be acute or chronic, perianal and saddle paraesthesia. It can cause bowel, bladder, and or sexual dysfunction. The symptoms for this pathology is unilateral or bilateral weakness in lower limbs, reduced or absent of lower limb reflexes, and lower back pain. And they had two characteristics, incomplete and complete. Incomplete is the loss of urgency or decreased urinary sensation, and complete is urinary or bowel incontinence or retention. For epidemiology and etiology, Cauda-Equina syndrome is rare with an estimated prevalence of 1 in 30,000 to 100,000 people per year. Annual incidents are between 1.5 to 3 million people, and the most common cause of compression in 45% of Cauda-Equina syndrome is a herniated lumbar intervertebral discitis, tumor, trauma, and spinal stenosis. For treatment, follow-up, and prognosis, the surgical treatment would be to decompress the spinal canal as soon as possible to relieve the impingement so that the patient can get feelings in their legs back. After the surgery, the patient would come back a few weeks later for the surgeon to check the healing and the progress of the pathology. Most patients require long-term follow-up with rehabilitation medicine. This syndrome is very rare, so they don't have a set time for follow-ups, but just regularly, or you're getting followed up after your surgery for a long time and maybe throughout your life if you're living with this syndrome. And for the prognosis, approximately 20% of all patients will have a poor outcome in terms of urologic and or sexual function, as well as lower limb paresthesia and weakness. And those are my references. Thank you.